Right now, the COVID-19 cases are increasing at a rapid rate in the province of Limpopo. The daily numbers have jumped from nearly 400 new infections on Tuesday to over 2,000 today. Let's speak to the province's health MEC, Dr. Phophi Ramathuba. Doc, I just want to let you and the viewers know as well that we've just heard that the Premier of KZN, Sihle Zikalala, is expected to speak to the media sometime this afternoon. And if it happens during our chat, I'm going to have to cut and go there, just so you're aware. This obviously has to do with the Free Zuma campaign. But coming to your province, MEC, obviously, as the MEC of Health in the Limpopo province, you must be concerned about seeing these numbers skyrocket. But do you have any idea the reason behind the numbers going up so high in your province?
Morning and morning to all your viewers out there, and thank you for inviting us. Yes, we are aware of the challenges that are facing the province. Initially, we were dealing with the issue of Waterberg district, the mining areas. It started with Tabazini. Now we have seen that the shift has gone to Lephalale, where out of the 701 cases that are recorded in Waterberg in the past 24 hours, 318 are now just coming from Lephalale. So in the Lephalale, you have got the fact that there are mining areas. So a lot of cluster outbreaks within the mining area. That's why you might have remembered that from the beginning we've been advocating to say, as Limpopo, we would appreciate if the vaccination of mine workers could be accelerated, because we know that is one of our major risks when it comes to this particular pandemic that we're dealing with. And also, secondly, Waterberg district has been at the same time being a border for Limpopo to other provinces, especially Gauteng and Northwest. Now, when we started to see Gauteng becoming red, it was very clear that as a province we can never escape the third wave. It was very clear. We've said to say, let's put up our response team to be ready, because once you see the red in Gauteng, the next stop will be in Limpopo. We see every Friday coming to North, the cars are very full. Sunday going back, you would see going south, the N1 south is full. So the results of that, you see it happening today. Now, of our concern, it's municipality like in Wembe district where Makado is driving these numbers, because out of the Wembe district cases of 463, Makado accounts to more than 210, which tells you that what we were saying and our analysis now is spot on, because we suspected that funerals could be super spreaders. And when we go deeper to analyze the people who are infected, mainly those villages and their family members of where there was funeral, we find we've got now family clusters outbreak where people with similar surnames, similar addresses are infected at the same time. So that means when you trace back, you find that they indeed did have a funeral. Remember, most of our people who are working, they work in Gauteng. And when, unfortunately, they succumb to COVID-19 complications in Gauteng, they come to want to be buried at their province of their birth, which is Limpopo. So during those funerals, I think we have seen our people starting to relax, and unfortunately, we have to deal with this current situation. Now, Capricorn district, where Polokwane municipality, it's also contributing a large number of positive cases. With that one, we can explain to say most of our economic activities and hub, Polokwane, it's our city in the standards of city in Limpopo. So that is why you see Polokwane municipality leading. So these are the three municipalities that are contributing if you compare to all the other municipalities. Other municipalities, they are still very low. But if we were to be able to contain the spread in Waterberg district and Capricorn here, Capricorn is only Polokwane. All the other municipalities are not as in danger like Polokwane municipality. And of course in Wembe, all other municipalities are not giving us a lot of stress, except the
MEC, MEC, have you heard anything or have you seen anything? Because we've seen in media reports some nursing unions, for instance, very concerned about hospitals in Limpopo possibly becoming super spreaders themselves with the number of people that need to be admitted. We know that the health system is quite strained during this third wave. In your truth as MEC of Health, what is happening in our hospitals in Limpopo?
What is happening, yes, we've started to see the cases of those being admitted. 2 weeks ago, we were sitting at around 190-something admitted patients within the both public and private hospitals. But if you look at the latest statistics, we have increased the total admitted patients are 538. Of those, 262 are admitted in the private sector, and in the public 276. And remember, the challenge why the private sector is at very strained is that in our province we have got fewer of such. For instance, here in Polokwane, we only have got 2 private hospitals. And if you look at the next other private hospitals in Tsaning, the rest of them they are not even less than 20 beds in their own capacity, which you cannot really categorize them as the hospitals that can deal with the pandemic. So the more you have people who do not really want to be admitted in the public service, that's why we are having serious challenges and problems. So in terms of our ICU, already we have got 38 in the private facilities admitted in ICU and 13 in the public sector out of the 51 that is currently in our ICU. So it's true that our private facilities are feeling the pressure. But in terms of our public facilities,